Hi everyone, welcome to my channel once again. Today we will have the introspection of the letter on April 23, 2022. So this letter is directed to a doctor. It is a community respiratory consultant. So we are going to present a patient with the pulmonology disease conditions, and we have managed the patient, but still patient needs some more assistance and further management. So for that we are sending the patient, we are referring the patient to a pulmonologist. So let us see the writing task. Using the information given in the case note, write a referral letter to Dr. Peter, Community Respiratory Consultant, for monitoring and support by outlining Mr. John's recent history and your concern. So just you have to take care something if it is given like outlining Mr. Johnson's recent history and concern. So like this in every question paper in the writing task you can see some things they have mentioned, means you have to explain that in detail in your letter. Anyway, we will move to the case note. You are a charge nurse who is working a respiratory ward of suburban hospital. Assume today's date is 8/1/2022. Patient name is Mr. Calvin Johnson, age 69. And we will move to the social history. He is a retired factory worker and heavy smoker, 20 cigarettes per day. And his alcohol consumption ceased, these and all, actually for as no need. And married with 2 children, we can write. Medical history, from we can see that the patient has had type 2 diabetes since 2008 and on diet control. And from 2021, patient has chronic obstructive pulmonary disease, shortness of breath, wheezing. So now he is on salbutamol 100 milligram 2 meter Ross inhaler. So patient is already COPD patient. And the scenario will start from 24 December 2021. Patient had shortness of breath, fatigue, lack of energy, and on the next day, a patient had the same symptoms. It's like exaggerated with the sputum production. So they contacted with the GP. GP advised for prednisone 40 mg daily for 4 days. So this is the past scenario. And we will see on 27 December 2021, patient's condition became worsened. Disorientation, confusion, everything got started. And this patient got admitted in the emergency department by ambulance with the shortness of breath, wheezing on exertion, lowered exercise tolerance, cough, sputum production, and his saturation was very low in room air. He has undergone various diagnostic evaluations like ECG, chest X-ray, ABG, full blood count, and sputum culture. After all diagnostic evaluations, his condition has confirmed as infective exacerbation of COPD. So this is the diagnosis of the patient. Infective because patient have sputum production and with the cough. So it's like infective exacerbation of COPD. And during hospitalization, he was managed with the oxygen therapy, salbutamol 20 mg hourly, prednisolone 30 mg BID, amoxicillin IV BID, and hydrocortisone 100 mg BID. So these all are relevant data. Gradually, you can see that on 6 January 2022, patient became normal, less breathlessness, lowered sputum production, and a cough already decreased, and saturation became 90 to 92 percentage in room air. So patient has good progress. Today, later day, all test results are within normal except blood sugar level. So patient is suspected to have, it's like a complication of steroid use because continuously he is on steroid, and this increased blood sugar level and tremor, these both are suspected due to steroid use. Anyway, the discharge medications are terbuline 2.5 milligram, prednisolone we have given 30 milligram, and salbutamol 100 milligram. Then discharge plan referred to community pulmonologist because patient still on medications and still we need to continue with the medications and continue with the assessment and proper management. So the discharge plan, monitor and review medication. All this discharge medication you have to write. Weaning from prednisolone gradually. Support for smoking cessation, pulmonary rehabilitation program, and monitor blood glucose level. So here, actually we have 5 recommendations. You can concise and you can write. The first one, of course, should be the monitor and review of medications. There you can write all medications in short. Then you can write regarding the prednisolone, you have to just mention that weaning gradually. Then smoking cessation and pulmonary rehabilitation program togetherly you can write in one sentence, and blood glucose level you can write along with the review of medication. Monitor and review medication and blood glucose level togetherly you can write. So in this way you can concise the recommendation paragraph. Once again I will read you the writing task. Using the information given in the case note, write a referral letter to Dr. Peter, community respiratory consultant, for monitoring and support by outlining Mr. Johnson's recent history and your concerns. So I hope this case note is clear for you. We will start with the date 8 January 2022. Address is Dr. Peter, community respiratory consultant. Salutation, dear Dr. Peter, regarding Mr. Calvin Johnson, aged 69. So this is the first part of the letter. Then introduction. I am writing to refer Mr. Calvin Johnson, who has infective exacerbation of chronic obstructive pulmonary disease. He requires further monitoring and management. So this is the patient's diagnosis, infective exacerbation of chronic obstructive pulmonary disease. And the requirement is further monitoring and management. So keep it in your mind. For doctors, don't write care. You have to write always like monitoring, assessment, evaluation, and management, interventions or treatment. No care for doctor's letter. Then we will move to the present medical paragraph. So in present medical paragraph, we are going to write about how this infective exacerbation of chronic obstructive pulmonary diseases happened. Until now, what were the things we did for the patient. Mr. Johnson, so we have to start with the patient COPD, because this patient already has COPD from 1 year, in the last year itself. So this is like an older story. We have to start with that because this letter is each and everything related to COPD. So we have to start with Mr. Johnson has had chronic obstructive pulmonary disease, don't write COPD, since 2021 and on salbutamol inhaler 100 mg. Full stop. Recently, he developed exacerbation of his condition and was commenced on prednisolone 40 mg for 4 days by his general practitioner. So that is the things that happened before few days. So we already informed that, already has seen by GP, and he has given 40 mg prednisolone along with the salbutamol inhaler. Then, so our things is starting with 27. On 27 December 2021, he was admitted with the shortness of breath, cough, sputum production, and low saturation. Thus, he has undergone various diagnostic evaluations which confirmed his current diagnosis. So, we will just write in brief, no need to write completely. He was admitted with a shortness of breath, cough, sputum, everything, and no need to write all diagnostic evaluations also, because they didn't mention that in which diagnostic test they confirmed the diagnosis. So it's okay, fine, we can write like this, which confirmed his current diagnosis. All diagnostic evaluations we can include in that. Again, no need to write infective COPD. Simply we can write confirmed his current diagnosis. Then next paragraph we can write, during hospitalization, Mr. Johnson was managed with oxygen therapy, his usual medications, antibiotics, as well as hydrocortisone. Here no need to write all medications information, because again we are going to write discharge medication. So almost all medications will come there. So it will be like a repetition. So just we can write in concise way. Like usual medication means it's like salbutamol and prednisolone. Along with that we have added antibiotics and hydrocortisone. In addition, oxygen therapy, we can write in that way. Gradually, he developed increased blood sugar level and tremors, most probably due to steroid use. So, during hospitalization, he made some complication. He has some complications. So they have given question mark steroid use. So that's why we are using the phrase most probably due to steroid use. Gradually, he made good progress. However, an expert assessment from your service is essential. So we can just sum up that he has good progress now, but still we need some assessment from your service. So this is the present medical paragraph. And we will go to the social paragraph. Mr. Johnson is a retired factory worker who lives with his family. He smokes 20 cigarettes per day. Medically, he has had diabetes since 2008 and on diet control. So this is the simple social paragraph. Nothing more is given. And the last one is the recommendation paragraph. As I told you before, we have to write the discharge medications here and we have to concise. It would be appreciated if you could take over the case of Mr. Johnson to monitor and review his medications and blood glucose level. Kindly note his discharge medications are, then you can write the discharge medications with the semicolon. Turbuline, 2.5 milligram, semicolon, prednisolone 30 milligram, which need to be weaned gradually, and salbutamol, 100 milligram. So you have to mention here. I have mentioned in between, so it's enough. Then please support and encourage his smoking cessation and pulmonary rehabilitation program. So we can write it's like togetherly. And there is no more confusion here. We have to concise. No need to go for like a simple sentences. We can just combine together with and or as well as. So I hope this is clear, this management. Then the last conclusion is, please don't hesitate to contact me if you have any queries. Then you are sincerely, registered nurse. So that's all the letter. I hope it is clear for you. We will see you with another one informative video. Until then, bye. Take care.